My husband Derek is vaccinated. I'm vaccinated. And in May, when the CDC and the FDA gave the go-ahead to vaccinate 12 and older, George can attest to this. I was there at Harvey Hall with my 12-and-a-half-year-old twins, and they got their shots pronto. And I love my kids, so I would not put them in danger. You know, they got their second shots with Net Health a few weeks later at the North Broadway Clinic. And, you know, all of this being said, I have a 9-year-old who's not vaccinated, and that worries me. That worries me with all the children who are not eligible for vaccines at this point, and all of those people who have medical indications that say they can't get vaccinated for some reason or another. It's really going to require a community effort, teamwork, to get us through this pandemic, COVID. You know, the Delta variant is so virulent or so transmissible. And there's a Greek alphabet soup of other variants that are on the horizon that if we can get widespread community type of immunity, that we can actually prevent that from creeping into our neck of the woods. So bottom line is, if you're on the fence about getting your COVID vaccine, please get off that fence and do it. None of this is going to go away until we achieve widespread immunity in our area. And the COVID vaccines are our arsenal, it's our tool to achieve that, because vaccines defend what matter to all of us the most. And that is, it protects the people we love, and it gets us to where we can be normal quicker. Thank you.
Thank you, Dr. Mitchell. So our next two speakers are two members of the community, two very trusted and very well-respected members of our community. Our first gentleman is Rev Ralph Carter, who's the senior pastor at St. Louis Baptist Church. So Reverend Caraway.
Thank you, Dr. Roberts, and to all of these clinicians that have come in and shared with us the importance of the vaccine. I'm reaching out to this community, the faith-based community, that is a vital part of this community. This community needs our help and to use our influence and to share with as many of our parishioners as possible the urgency of receiving this vaccine. And I thought about this, and I thought about how faith and science has an opportunity to work here to be very effective. I know there's a lot of misinformation concerning the vaccine, but let me share with you my personal approach to all of that when I say faith and science. There's a whole lot of things about faith that we really can't prove, but we have them because they are faith. But there are so many things that have been proven about taking this vaccine. From a personal standpoint, I've had the misfortune of having to be with so many families that have lost loved ones because of COVID. In those dying hours, not being able to be with those loved ones. And to see the agony that those families had to go through that can now be prevented because a vaccine is available. When there was no vaccine, the horror of watching those families lose their loved ones because there was nothing in place that could handle the trial that they were dealing with. And so now we have a vaccine that can change a lot of that. And so I'm making an appeal to all of our faith-based community. And we talk about this faith that we have. And it's time to really exercise that faith that we say we have. We are so blessed in this community to have a medical community that have our best interest in mind. And so, just for the sake of the sorrow that I've experienced this last year plus, being with families that have lost loved ones, not being able to visit them in those expiring hours, it prompts me to try to encourage everyone that has not received a vaccine, if you please would, please, faith-based community, again, we talk about faith. But faith is the substance of things hoped for and evidence of things not seen. But we have seen what happens when people that are not received a vaccine, how vulnerable they are to this COVID disease. And so I want to encourage all of us that have whatever your circle of influence is, that you would please encourage someone to receive the vaccine. Thank you.
Thank you, Reverend Caraway. And Reverend Caraway has, during this time, he's offered up his church not only as a testing site for COVID-19 testing back in the fall and early spring, but also he was a vaccination site gave a number of vaccines at his church back in March and April. So we're very grateful for what Reverend Caraway has done for our community during this time, and also during all he does for our community. Our next speaker is our Smith County Sheriff, Larry Smith. Sheriff Smith.
Good afternoon. I echo exactly what Pastor Caraway said, and you think he really said something then, you ought to listen to some of his sermons. But I'm here from the perspective of my employees who have and have not taken the vaccine, as well as inmates who have and have not taken the vaccine. Up until about a week and a half, 2 weeks ago, we had been COVID-free in the Smith County Jail for probably about 4 months. At the time, we had rampant COVID in the jail, where between 200 and 300 inmates that had COVID. We went from just a few to 102 this morning in about 3 weeks. And we can't quarantine fast enough to get it slowed down like we need to. We finally got it where we can quarantine, quarantine inmates coming into the jail. We have to have room to do that. We had brought all of our external inmates back into the jail because COVID had been gone, and then it came back, and we couldn't get them out fast enough to help control the COVID. But we're at 102 today with 14 outstanding tests. We have, I think, 15 jail employees out with COVID, and I believe we have 12 that are quarantined as well. What I would also ask people not to do, well, let me first of all tell you people what you should do. And I'm speaking as a parent, I'm speaking as a sheriff who loves the men and women in this county. And I had the good fortune of knowing Dr. Mark Anderson for quite a few years, probably more than either one want to talk about. And after I'd had about 3.5 weeks of COVID myself, had a pretty rough go at it, Dr. Mark Anderson came to us at the sheriff's office, to the command staff, and offered his time and his expertise to help us talk to people and say exactly how the vaccine works in your body. And that was one of the best things that we've had happen to encourage people at the sheriff's office to get the vaccine. We have also, through Net Health here, offered the vaccine to all pretty close to 1,100 Smith County jail inmates. Of about 1,100, we had only 200 that took it. We're going to be offering it again here pretty soon, but we can't get them that hadn't been in close contact with COVID far enough away to get the vaccine yet. But again, I'm here as a man who loves his community, who loves his family. I'm not here as a politician. Matter of fact, my pastor, David Dykes, Dr. David Dykes, put it best. You have to take politics and divide it in half. Poly means many, and tick is a blood-sucking parasite. I am not a politician. I've never been accused of being a politician. I try to do what's right, and that's what I'm trying to do right now. So I'll leave it with that. Thank you.
Blood-sucking parasite, huh? That's pretty good. So, before I take questions, let me just do a quick summary here. My first point is that COVID-19 is surging here in East Texas right now. Number two, Tyler Hospital's COVID-19 caseloads have increased. There was only 45 East Texas and Tyler, Texas hospitals on July 8th. Today, the report I received this morning was there are now 213 COVID-19 patients in East Texas patients in Tyler, Texas hospitals. So it's gone from, in a month's time, it's gone from 45 to 213. And as Dr. Anderson mentioned here, he said that, 95% of the patients, his hospitalized patients, have not been vaccinated. Let me repeat that. 95% of the patients in Christus right now have not been vaccinated. I didn't hear Dr. Cummins comment on that. Dr. Cummins, is that about the same? So we can say 95% of the patients in our hospitals right now have not been vaccinated. Sheriff Smith mentioned 102 inmates are now in the Smith County Jail. That's just gone. It's gone from 0 to 102 in a very short order. And he's mentioned like 14 or 15 jail employees directly out right now with COVID. So what can you as a citizen of East Texas do about this? If you're 12 and older and have not yet been vaccinated, please get vaccinated today. Don't wait any longer. It's time to get off the fence about this. Please get vaccinated today. And if you can't do it today, do it as soon as possible. That is the best thing that we can tell you to do about that right now. If you have questions about it, we all have questions. That's what your doctor, your healthcare provider is for. If you're not sure, ask your doctor or ask your healthcare provider, please. There are many locations here in East Texas to get your COVID-19 vaccines. Area pharmacies have this. Area clinics have this. I'm going to read you just a list of what's available through NetHealth. NetHealth offers the COVID-19 vaccine Monday through Friday at our 815 North Broadway location. We're there from 8 a.m. to 11 a.m. and then 1 to 4. So Monday through Friday, NetHealth, 815 North Broadway. We're going to have our Health on Wheels mobile van out bus parked Tuesday, Wednesday, and Thursday, really for the next couple of weeks at UT Tyler from 10 a.m. to 3 p.m. So if you're a student that goes to UT Tyler, or if you're part of the UT Tyler community over there, go get vaccinated at our Health on Wheels bus. We'll also be holding clinics in numerous East Texas cities, and includes Kilgore, Alba, Mineola, Elkhart, Chandler, Palestine, Quitman, Chapel Hill, Troop, and several other locations in Tyler. You can look to our nethealthcovid19.org under Get Vaccinated. You can see exactly where these are. So you can, as you're telling citizens about this, your audience, nethealthcovid19.org, please list that out there. It's been mentioned before, I mentioned again, COVID vaccines are free. COVID vaccines are free. This is a free vaccine. You know, how many of us will go see a doctor sometimes? We have a sinus infection or something's bothering us and ask for a magic pill. Ladies and gentlemen, this can be your magic pill right now to not get COVID. And if you may get COVID, but your risk of being hospitalized is greatly reduced. So please, the message for today is, again, COVID cases are going up. Hospitalizations have skyrocketed. One of the best things that you can do as an individual, what can I do about this? Get vaccinated if you're not already vaccinated. Now, with that, I'm going to pause and ask for questions. We have a pretty smart group of people here to my right that'd be happy to answer any questions you might have. Yes, sir, Terrence.
So I have a few questions that were sent in through our Facebook page or our website. This is a hospital question. Can you provide a demographic profile of the average person who is currently hospitalized due to COVID as compared to the demographic profile from earlier this year?
Okay. Dr. Anderson, Dr. Cummins, I'll step over here. And
You want me to step up? Okay. I'll wait for Tom. Well, actually, our data is probably very similar. Our age range is from 15 to 85 hospitalized. We've seen it shift to a younger age population. During the winter, our average age was 70. It's now 60, but a really high number of patients, a big surge in the 45 to 60 age group, really. So it's younger adults. Many of them do have comorbid conditions, but remember, many of us do, whether it's high blood pressure, we're overweight, we have a little type 2 diabetes, a little metabolic syndrome. All those things are risk factors, as well as asthma, lung disease, other heart disease. So, but not everybody. We're seeing younger and younger patients with fewer and fewer comorbidities. So it is different than this winter.
Yeah, I would say we're seeing very similar numbers. maybe a little bit younger than on the average than what Dr. Anderson is seeing. We're seeing a significant number in their 20s with and without comorbid conditions that are requiring ventilator support. Ours have ranged in age from, I think, 17 is the youngest I've seen to 96. Again, primarily folks with comorbid conditions, those diagnoses that Dr. Anderson mentioned. But we are starting to see some that aren't. And in our outpatient setting, we're seeing children under the age of 6 months testing positive for it as well as a number of kids, school-age kids that are testing positive. So it is certainly running rampant through all parts of our unvaccinated community.
Thank you. Yes, ma'am.
I have a question for Dr. Mitchell, if I could.
Dr. Mitchell.
Hello.
Hi.
Thank you. I'm a CBS 19. I wanted to ask you in particular because you mentioned having a child younger than 12. So I wanted to hear what you would say to other parents who have children younger than 12, going back to school in the next couple of weeks, and also going back to a lot of schools who don't have mask requirements for their children, and their children are going to be around other children who may or may not wear their masks. What are they supposed to do?
I really feel like even if there's no mask requirement, there is no edict that says you can't wear a mask. So I would say to those parents, equip your children with masks, make sure they know good hand hygiene, make sure they try their best to socially distance, and all the things we did last year that kept all of our schools safe last year still apply now. You know, I heard a pretty interesting comment from a colleague of mine, another family physician, and they talked about the layered approach to safety for our children since they can't get vaccinated. And the analogy was to, you know, when you go buy a car and you look for all those different safety features, you look for lane assist, that backup camera, all those things, those gadgets that keep you safe. Well, you know, thinking about how to keep our kids safe is going to be a layered approach too. We don't want them, we don't ever expect to have a car wreck, right? And so we do all these safety things to prevent it. Well, I would really advise parents to think about all the things of layers of safety they can provide for their children to keep them in school. So that's how I'd respond. Okay.
Next question. Yes, ma'am.
Kind of bouncing off that, you know, we're telling children, students, parents what they can do. Is there a message from anybody to school district administrators about what they might want to see, or sort of just in general a message to them going into this next school year?
Sure. Dr. McGahey, would you like to?
That's a good question, and Mr. Roberts and I and several others met with all the school superintendents of Smith County last week. We're meeting with them after this meeting again to give them a briefing. We talked about the latest CDC guidelines, which came out August the 5th. The TEA submitted guidelines the same day, and we also discussed the masking. Although it can't be mandated, it can be strongly recommended by school administrators. So we supported that, and they supported it too, based on the information that we gathered last week. Other things that the guidance says, you know, at least 3 feet of space between school-age kids, as Dr. Mitchell said, that layered approach, adequate ventilation in rooms, masking, you know, having sick children not come to school, and if they're over 12 years of age or older, receive the vaccine, and encourage all your faculty, staff to get vaccinated too. So that bundled approach, but we'll be talking to local school administrators at about 4 o'clock today. Thank you.
Next one. Yes, ma'am.
This is just a general question. So Dallas schools just announced that they're requiring face masks as well as contact tracing. Is that something y'all think are going to recommend to local districts?
Well, Dr. McGee, you want to respond to that again?
You know, I think some schools may require it. I think that's up to the individual schools. You know, we're looking at the executive order from the governor, which stated that it can only be recommended. That's what we're working with now. We'll be in discussion again with school superintendents to see what they decide to do. There's a lot of time between now and when most schools start, I think August 23rd. Some start earlier than that. Things could change, but I think that important message will be masking. Even when it's mandated, some kids still don't wear them, but I think all of us, based on the information we have today, think it would be wise for students to mask up that are 2 and older and faculty members to do that when they go to school.
Let's see, who's next?
I can ask,
Sure.
have the healthcare organizations come together, maybe talking about going to Austin to see if they can get more staffing like they had back in January previously? There been any talks with that, or is it?
Yeah, I think Dr. Anderson or Dr. Cummings, do you want to respond to that one?
I don't think I could say that the 2 organizations have come together to do that, but our organization, we have a parent or a sister organization, the Amarillo, have both worked with our government relations group to help go to the state and ask for a statewide approach to fighting the pandemic as opposed to the current sort of county, city approach with some of the funding that's come out. So we have asked the state to take the lead in helping fight this off.
Yeah, I saw that there's actually a Senate committee meeting in the morning to discuss this same topic. So I guess at 9:30, Senator Colcourse committee. I think I saw a notice about that.
George, I'm curious, I know we've talked about hospitalizations being somewhat of a lagging indicator. What's the timeline right now in general, what we're seeing the most when it comes to when a person gets ill with COVID, the first symptoms, to when they get to the point that they actually have to be hospitalized?
My perception, Blake, is that it's much faster than we saw before because I was looking at our numbers the other day. It seemed like the uptick in our numbers really started around the 16th of July, and I know our first big pop in cases was between the 8th and the 15th of July. So that time period is when it really started to increase, and I think the next week is like 75 in the hospital. The week after that, 85, then it went down to 78, and then it clicked back up to 107. So it seemed like it's pretty much the time they get diagnosed is pretty much they're going in the hospital pretty quickly, I think now. Would y'all agree with that, Dr. Anderson, Dr. Cummings?
Yeah, generally.
Yeah, it seemed like it's a quicker. Before it was a lagging indicator. So now it seems like it's not quite as much of a lag as it was once before.
Do you guys see any trends this time compared to last time that kind of led towards the mandates and the shutdown? Do you see anything trending in that direction again?
I don't. In my perception in the state of Texas, that's the shutdown will not happen. That's just reading just watching what I've seen from the governor's office. I don't know if anybody else has a sense about that, but I don't see any kind of thing from shutdowns. Sheriff Smith, I don't think that's going to happen. So I think it's basically, I think the idea is that, and that's really part of our message here today is, we can't force people to get vaccinated. I can't force anybody to get vaccinated. What we're trying to do right now is to appeal to people and say, here's the information. And we've tried to approach this whole time when we visited with you about, the issues. We tried to basically say, here are the facts. And the facts are we know that the vaccination worked because back in, they talked about January, February, we noticed when we were able to start getting substantial amounts of vaccine into people, probably late February as we started to see the case numbers go down in the hospitals, as well as our positive case numbers started going down as well. And we ran a pretty steady track there until really middle part of July. So that's kind of has been our trend line here. Yes, ma'am.
General question, are symptoms still pretty much the same, or are there any new symptoms with this Delta variant that people could be looking for to say, oh gosh?
Any new symptoms? That's a great question for any of the doctors. If y'all, you want to?
Generally the symptoms are about the same: cough, congestion, fever, some GI stuff. I think with the Delta variant, we might be seeing just a little bit less of the loss of taste and smell that was so prominent early in the pandemic, but generally there's nothing radically new in this. It's just a variation on what we've seen before.
Yes, sir.
Another email question. So the Gregg County press conference earlier today, there were summary statistics of their COVID inpatient
leaders on the spread of COVID-19 in our area. Dr. Liu Mitchell giving a plea for, quote, community immunity to COVID-19 by getting the COVID-19 vaccine. Dr. Mitchell also telling our Shondell Moniz that it'll be a layered approach to keeping our kids that are under 12 safe by masking up, social distancing, and of course sanitizing wherever possible. Rev Ralph Carter, pastor of the St. Louis Baptist Church in Tyler, was there as well, reaching out to the faith-based community, speaking on being with families that have lost loved ones throughout the year. And he says, quote, it's time to exercise that faith we say we have. And speaking of how blessed we are to have the medical community we do in East Texas. Smith County Sheriff Larry Smith speaking as well. He spoke on the outbreak in the jail, saying that there are approximately 102 inmate cases and 14 outstanding tests in just a few weeks. He said the department can't quarantine people fast enough to help control the outbreak. One thing is clear, everybody speaking shared a similar message, and that's get vaccinated. NatHealth CEO George Roberts sharing that Tyler hospitals are seeing a significant increase in cases. They saw 45 on July 8th, and today there's 213 COVID-19 patients in Tyler hospitals, so a significant increase in just a month. 95% of those patients haven't been vaccinated as well. Of course, we'll keep an eye on this as we go out throughout the day, and of course you can find the latest on our website at cbs19.tv as well. We'll also have the latest on the CBS 19 News at 5. We now return you to your regularly scheduled programming.